Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Could we take up briefly sneezing?
Yes.
Many people sneeze during the day. They don't have a cold. They have no other symptoms.
Yes. See, sneezing is something which is a reflex, which can be induced by some sort of a tickling in the nasal mucosa. See, our nasal mucosa is very sensitive. Any dust particle which is not even visible, invisible dust particles or even pollen grains, when our nasal mucosa comes in contact with that, develops a reaction, and as a reflex reaction, it's a violent snuffing off. It's a jerky snuffing off, and one gets sneezing, one or two bouts of sneezing, and then things are resolved. Suppose there are like old mites, like old books, especially if we have not handled it for say few months and lying in cupboard, the mites grow on that. And if you just dust it off, that dust, the moment it enters, a natural reaction will be to just make a repulsion, throws it off. So it's a reflex reaction by the body to have sneezing, so that the underlying respiratory tract is kept safe. But many times people have some hyperimmune response, even for a trivial, dust which is not harmful. There also they develop sneezing. But sneezing is not something which is harmful.
Only thing there's an old saying that you're closer to death when you sneeze. That's totally false.
Oh, yes. It can't be. It can't be. Sneezing is something which is a natural response so long as it is moderate. So long as it is moderate. But if person is what we call idiosyncrat, so like a common percentage of dust particles in air, that also is leading to sneezing. Or little bit of some incense stick that smell, that also is leading to sneezing. Even some people putting scent or some perfumes, some people are ultra sensitive and they have developed sneezing. So that's again a sign of what we call hyperimmune response, which is like a knee jerk. And therefore people say that you are become ultra sensitive to this, you can't tolerate even a normal thing, and therefore maybe you are losing your immunity in that. But other than that, sneezing is very common. There will be no one who doesn't sneeze some or the other time. Only thing is, some people who have problem with sneezing, especially bladder incontinence, there the sneezing means there the bladder gives like some sort of a urine escapes. There you have a problem, but there also if you are careful while sneezing, there should be no problem. But we have seen some people of violent sneezing that can affect your eardrum also, because that creates a vacuum. Because when you sneeze out with force, there is a vacuum created in ENT passage, and that may affect your ears. So sometimes violent sneezing is harmful. So we have to train the person to sneeze properly, so that there is no extra vacuum created and it doesn't harm your eardrums. Because any vacuum created in the throat will affect your ear, because eardrums are through eustachian tubes, your ears are connected with it. And what you said about sneezing, that holds true for hiccup. In old people, if they get hiccup, then that can be a very bad sign. Like we see, hiccup can be a sign where the renal failure has advanced. There are many cases we have seen that hiccup is only indicator for renal failure investigations, but not like sneezing. Sneezing is very common.
Okay. Thank you, sir.